My next guest is Congressman Tony Cárdenas of California. He's a member of the Energy and Commerce Committee and sits on the Healthcare and Mental Health Task Force of the Congressional Hispanic Caucus. Congressman Cárdenas, it's great to see you here. Tell us how you've got all sorts of legislation in the health field. It's your hobby or obsession, I don't know. But tell us, as you kind of interact with your constituents and they see missing gaps in healthcare that they think need to be fixed, what are you working on of highest priority?
Well, my highest priority is to make sure that we have access to healthcare to as many Americans as possible. Many people have heard about the safety net system. I grew up in a community where we were dependent on the safety net system. In LA, that's the LA County system. But we have affluent hospitals in our community that actually have better equipment. They have reserves, financial reserves, et cetera. So what I'm trying to do in Washington is pass legislation to make healthcare more accessible to everybody, to as many people as possible, while making sure that we're not hurting the system, but we're improving the system overall. So many of my bills have to do with access to medications to more people. Many of it has to do to make sure that the reimbursement rates at the federal level are fair, so that more hospitals and more physicians and more people who practice health will actually be involved in helping people who are dependent on Medicare, et cetera, and other parts of our healthcare system.
Another thing you're doing that I really appreciate, and we've talked about it in various other programs earlier today as well, was, whole health also includes mental health, behavioral health, and then what you're working on, the Behavioral Health Crisis Services Expansion Act. I just really feel strongly that ought to be part of the conversation here. And I'm not sure when it comes to reimbursements, when it comes to the way the economics of the healthcare system works out there, that's given as much attention as other elements of health. Am I wrong?
You're absolutely right. One of the biggest problems with mental health is, for a long time, public and private institutions were trying to do their best, but at the same time, honestly afraid to give more services because the need is so big that once they start giving those services, they get overwhelmed and they get underwater financially because they can't afford to sustain that kind of service when they're not being reimbursed and or they are not given the resources to continue. And then that's been one of the burdens on both public and private institutions. So what have we had in America? The people who were able to get access to mental health services were the wealthy because they could afford $150, $250, $350 an hour to be able to pay for that healthcare service, mental health care service. Yet at the same time, on the other side of town, in other households, they depended on their system to say whether or not they could get mental health services. Now, everybody for a long time has been able to get physical health services. In other words, to go see a doctor, get a checkup, or if you get a cut or a bruise or what have you, you can see a doctor and get help. But if you have a mental health issue, it was incredibly limited. Now with the Affordable Care Act, we're mandating that the healthcare system, including the insurances and the providers, that they make it accessible. So we're still trying to make sure that the system itself on the ground catches up to that. And we have various bills to try to make sure that we are requiring people to pay attention to the fact that mental health is related to physical health. And it's a holistic solution when it comes to human beings. Not just physical health, but mental health are big factors as well.
Another big question, I have to admit, Congressman, I don't know if I'm going to get this out right, because whenever I get my head into the kind of healthcare ecosystem, it gets extremely complex really quickly. Lots of different moving pieces and tectonics, in this. But one of the areas I'm interested in is how do you get the equilibrium right in areas like competition, on drug prices, on provision of care in hospitals, the tension between urban centralization and rural care, because it seems like we have to put the lines in certain places. In pharmaceutical area and development, there's a social contract around innovation, and then removing that so you can kind of move and get those costs down. I'm just wondering, in your broad survey of this, do we need to take a look at where the incentives are not working anymore, where we don't have enough competition?
That's a great question. And you just explained how complicated it is. It's not real simple. It's not black and white. If you move one thing, something else is going to have an effect, both positive and negative. But let me give you one example where science has really come a long way. And when it comes to something called biosimilars, we need to make sure that we encourage the innovation of biosimilars and also incentivize the system to get away from both physicians and patients dependent on prescription drugs that are not within the biosimilar space. Biosimilars have been approved by the FDA. That's going to bring a lot more competition into the space, which means it will bring prices down, make it more prevalent and available to more people across the spectrum. Like I said at the beginning of my comments, I'm working on, and many of my colleagues are working on, making sure that healthcare is available to as many Americans as possible. And when it comes to prescription drug pricing, that's something that is really, really upsetting the American people. And right now in the Build Back Better Act, we do have a piece of legislation in that large legislation to bring down drug prices so we can have a better negotiable system when it comes to the federal system. So those are some examples of what we're trying to do here. And to me, we need to make sure that we take advantage of science as much as possible and make sure that we have better competition and we incentivize both the physicians and the patients to be able to have access to more drugs that are going to be solving their issues and increasing their quality of life. And actually, in some cases, these drugs are actually saving lives.
You know, in the biosimilar case, Congressman, you know, Europe has so many more biosimilars approved than the United States, and the FDA has begun to pick up the pace a little bit, but it still lags way behind Europe. And I guess, though, as I've understood it, one of the areas or gaps is in the way, you know, the FDA requires all sorts of data, human data, and part of that data is held by, you know, the property rights holder of the drugs that the biosimilars are seeking to come in and not replace, but just sort of add an adjunct in there. And it's also, again, really important within patient-centered medicine and precision medicine to be able to get some of this right and tailored in. But part of it is data sharing, and part of it is trust across different parts of the industry. What do we do to do that? Is that something that has to be legislated?
Yes, unfortunately, it does have to be legislated. It's a delicate dance, like I said. It's very complicated. And the bottom line is this. Sometimes you have cases where hundreds of millions or billions of dollars are invested in a product that comes to market, and it is improving the quality of life. It is effective. And then, like I said, in some cases, saving lives. So what happens is those drugs are available to be on the market for a certain period of time. After that, we're supposed to have a system that opens up the competition so that others can actually make competing drugs to have an equal ability to actually improve people's lives. But at the same time, you pointed out something very important. We have to figure out better ways to make sure that that information is shared so we can get that competition into the system sooner than later. Nobody wins when people are allowed to drag their feet, and we're actually preventing good drugs to hit the market sooner so that it can have more access to more people. And that's the main thing that I need to emphasize. We have a great system in the United States when it comes to the FDA is the most respected approval organization on the planet. Yet at the same time, we can improve it. And one of the ways to improve it is to make sure that we have better cooperation, just like you described.
Well, thanks very much. Just finally, you know, I know that Build Back Better has not passed yet, and I'm also have not read the bill, although I should. Not sure where all the lines are written there. But, you know, when it comes to the health provisions, what are you hopeful changes, if anything, if Build Back Better becomes law?
Well, one of the things is I hope that we have a system that starts the ball rolling forward, where we have more negotiation, which will flatten the prices of prescription drugs, make it easier for American citizens when they go to the counter to not be in a situation where they are just in pain, not physical pain, but mental pain, thinking like, I can't afford that deductible. So everybody involved in the system needs to make sure that they're at the table, actually making sure that we have a system where when somebody's prescribed a drug and they want and are willing to take it, they're going to buy it at that counter and not say, I can't afford it, and leave it on the counter. That's something that's happened in too many parts of our country, and that's one of the things that we're trying to improve upon in the Build Back Better. And after that, we're still going to continue to do more.
Well, Representative Tony Cárdenas of California, member of the Energy and Commerce Committee, I know you were down on the floor voting, and I'm really grateful that you kind of snuck out of that to come give us some of your thoughts today. So thank you so much.
Thank you. Pleasure to be with you.